Thank you, Aaron. Merci de m'avoir invité. Bienvenue à Ottawa pour ceux et celles qui viennent de l'extérieur de la ville. J'espère que vous aurez l'occasion de voir, de visiter notre belle ville pendant la conférence. It's really a great opportunity for me to be here, and on behalf of my colleagues, the 2,500 staff and physicians at the Children's Hospital of Eastern Ontario, to thank you for what you do to keep kids out of hospital. And I think that one of the realities of working in a children's hospital is there is no better place to see and understand firsthand that health begins at home, begins at school, begins in our communities. It does not begin in the healthcare delivery system. And that what determines our health is social circumstance, is income, is the state of our housing. And you know, at CHEO, today, there'll probably be somewhere between 200 and 240 kids in the emergency department. We know that more than half of them, about 54% of them, actually live in housing need. They live in housing that is either inadequate, unaffordable to their parents. Their families are spending too much of their income. At CHEO today, we will see kids with who will have very intrusive and significant dental surgery. Dental surgery is one of the most frequent surgeries at CHEO, and most frequently takes place because families have had inadequate access to dental services, something that I know is changing in our community and across the province. We know that inadequate income supports shape every aspect of a child and a family's health. And we also know that income inequality is a driver of ill health, the work that Richard Wilkinson, amongst others, has done. And one of the really noticeable things, at least to me, about the conversation in healthcare about the escalation of cost in the health delivery system and increasing demand, is that when you look at all of the models that project out utilization of our healthcare system, they have all kinds of factors embedded in them, mostly demographic factors, issues related to population growth, analysis of changes in medicine, pharmacology, other drivers of demand. But actually none of those models look at the growing gap in terms of income and how it will drive healthcare demand. And you need only go to your local hospital to understand that in many ways our universal health delivery system is the safety net of the safety net. That when we don't, in fact, do a good enough job ensuring that our friends and neighbors, that our communities have access to economic opportunity, have access to employment and housing and the social supports that we all need in order to be successful in life, that will manifest itself in the health delivery system. So I was really pleased to see the theme of this conference as whole child, whole community. And really want to talk to you today just about two things. First of all, that why in an aging society we need to focus on kids, number one. And number two, looking at this room full of leaders, you are all leaders in your communities and in your sector, I want to talk a little bit about why leadership is overrated and doesn't really matter. So kids and seniors, so we're all in this together, right? One of the things that, now that I've been in the child and youth sector for quite a number of years, one of the things that is blazingly evident to me, certainly as working at a children's hospital, is that a lot of the thinking work, a lot of the policy development work in the healthcare system, for sure, is focused on the needs of an aging population. So a lot of the investments, the new investments, a lot of the policy reflection is in areas like long-term care, home care, addressing the needs of seniors who end up in an acute care hospital even though it is not really where they should be, and a lot of focus on the goal of how to help keep seniors healthy and independent and in their own homes as long as possible. And, you know, public policy, as everybody in this room knows, public policy lags the culture. And so the fact that we're talking about that in the healthcare system is a reflection of the fact that the whole society is grappling with the issue of an aging demographic. I noticed a news item a little while back. Apparently, the Paris runway, in terms of fashion industry, has now focused on this issue as well. I don't know what that means, perhaps no more sleeveless gowns. But even the Paris runway is thinking about how to adapt to an aging society. So clearly an important issue, clearly and appropriately top of mind. And I guess my message then from pediatric healthcare perspective is that if we care about today's seniors, we need to invest in long-term care and health and social supports for seniors today. If we care about tomorrow's seniors, we need to invest in children and youth right now. Because kids today are, in fact, as we all know, the parents, the caregivers, the innovators, the taxpayers, the workers of tomorrow. And our competitive advantage here in Ottawa and our competitive advantage in Ontario is that, in fact, the numbers of children and youth are increasing. In this city, in the next 20 years, there will be a growth of 22-23% in the number of children and youth. So there will be 70,000 more kids in Ottawa 20 years from now than there are today. Across the province, the comparable figure is some 600,000, 700,000 more kids 20 years from now than there are today. And so while it is true that the proportion of children and youth as a proportion of the whole population will be lower, in absolute numbers, it will in fact be greater. And in absolute numbers, we will need the talent of each and every one of those kids today, adults tomorrow. We cannot afford to leave any talent on the table. And you need to focus, we all need to focus together on how we mobilize that unbelievably precious resource. And so I really want to talk specifically about the two burdens of illness when we talk about children and youth that are the most significant, that are the most pervasive, and that are actually also the most linked to the social determinants of health for which you are directly accountable and responsible. And those are, of course, mental health and childhood obesity, both of which are proxies for the overall well-being of families in our communities. So a few words regarding mental health. And you know, I feel tremendously encouraged by the progress that we are making as a society. And again, you know, public policy lags the culture, but you can feel the culture changing as it relates to mental health and mental illness. The willingness of prominent people to speak publicly about their own struggles and about how mental illness has affected them and their families. We have seen in this community the unprecedented courage of some families in coming forward to talk about the tragic death by suicide of their children and to mobilize others across our community to take action and to get to work. I need to remind you that approximately 1 in 5 of us are affected directly ourselves by mental illness. And that will mean that in this room, every single one of you has been touched by mental illness, either yourself directly or somebody that you care about, somebody that you work with, somebody in your community or family. It means across the country, some 500,000 Canadians who are unable to go to work, at least one work day this week due to mental illness. 30% of disability claims, economic impact of $51 billion per year. According to the World Health Organization, depression will be the single biggest medical burden on the healthcare system by 2020. So in our context at CHEO, to make it local, but it's happening in your community pediatric health center as well, the number of emergency visits, so visits to the emergency department in crisis for mental illness, has risen 67% in the last 3 years. The inpatient occupancy rates have gone up a comparable amount, and the referrals to outpatient clinics have gone up by 100% in the last 3 years, which means that wait times have gone from 6 to 12 months. So that's a whole lot of statistics. So here's why it matters. It matters because 2/3 of adults who are struggling with mental illness, those older adults that Jim Watson was talking about encountering at the Shepherds of Good Hope, that 2/3 of them will trace the onset of their mental illness to adolescence. We know conclusively and absolutely that if we can intervene early, if we can touch the lives of adolescents as they begin to struggle with mental illness, we can literally change their future. We can change the entire trajectory of their lives and therefore the entire trajectory of our community's life. When you ask the frontline workers in our emergency department at CHEO what they would want to see the most, they will tell you it is more workers specialized in mental health within our hospital's walls, but more significantly, it is more supports for children, youth, and families outside of our hospital walls. So as an institution, we do work with community organizations and have worked, in fact, with the City of Ottawa through City of Ottawa Public Health to establish a new program for kids who are discharged from our inpatient mental health unit so they have somewhere to go when we discharge them from the hospital. But I would encourage all of you, as you think about that theme of whole child equals whole community, to think about the 1 in 5 families in your communities that are struggling with a child or youth who's dealing with mental illness, and to think about what it is that you can do to support the service delivery system, what you can do to strengthen our community's response, what you can do to mobilize the 80% of families who are not, in fact, struggling with a child or youth with mental illness, to see how they can be part of a support system that makes our community safer and that changes the trajectory of those young lives. The second issue in terms of burden of disease in children that I wanted to speak to you about briefly this morning is childhood obesity. About a year ago, the Minister of Health phoned me up and asked me to co-chair a panel to develop a strategy for Ontario on childhood obesity. Now, I had just started at that point. I was 6 months into my job at CHEO, was really busy, and wasn't really looking to take on another assignment, but just let me tell you, when you run a public hospital in the province of Ontario and the Minister of Health calls, you say, yes, ma'am. So I signed up for what turned out to be a tremendous eye-opening opportunity for me. CHEO has great depth in this area. Canada's leading researchers in the field of childhood obesity in the Healthy Active Living and Obesity Research Group, clinical programs, and so a lot of resource to draw on. And one of the things I learned, and one of the things I really, I suppose, believed at the outset, but truly came to understand by the time our Healthy Kids panel concluded its work, was the degree to which childhood obesity is actually an indicator of the social status of kids and the overall health and well-being of children and families. This is not a mathematical equation, as some would have you believe. This is not calories in, calories out. This is not move more, eat less. This is a complex social problem. And how we fare as it relates to our progress on childhood obesity really is an indicator of how well kids are doing in our communities. And in fact, over the last 30 years in Ontario, the rate of overweight and obesity has tripled in our province, and it is projected at this point, in fact, by researchers at CHEO, that by 2040, 70% of today's children will be overweight or obese adults as they enter middle age if this trajectory is not altered. And I don't need to tell you the toll that will take in terms of human health, in terms of economic competitiveness, in terms of impact on our communities. And it was interesting to see just a few months ago UNICEF issuing a report on child health, and Canada ranks 27th out of 29 Western developed countries in terms of obesity and child health generally, which is, I think, for all of us, a shocking statistic. So what do I mean when I say that childhood obesity is a proxy for the health and well-being of children? One of the things that became crystal clear in our work was the degree to which income is a driver, for example, of obesity. The number of Ontarians Ontario families who live in food deserts, in other words, in neighborhoods and communities that don't have access to affordable, nutritious food. The proportion of schools that don't have school nutrition programs that often are the only nutritious meals that some children will receive. The link between mental health and income on overweight and obesity. The absolutely conclusive evidence that the health, not surprising, but conclusive evidence that the health of pregnant women and the health care delivered to newborns and moms is fundamentally determinant of rates of overweight and obesity and health more generally. So think about the programs that you're responsible for. Think about the services that at the municipal level you have accountability for. And think about the impact that they could make in terms of helping give kids the best start in life, and then ensuring that they live in environments and they live in communities that foster their health and well-being. And both as it relates to childhood obesity, if we can make a significant dent in childhood obesity, if we can intervene when it comes to mental health earlier, more quickly, more effectively, the combination of those two interventions will transform in ways that are unimaginable, will transform and alter the trajectory of young people. And I mentioned those two areas as opposed to cancer research or rare genetic disease because those two areas in terms of their impact are the broadest, and those two areas in terms of the work that you do are the most connected. And I want to encourage you to think of your work in that very, very broad way and to be leaders in your communities in making change happen. But in fact, maybe I don't want you to be a leader in your community. And on that note, if I could just ask for some audio-visual support.
If you've learned a lot about leadership and making a movement, then let's watch a movement happen start to finish in under 3 minutes and dissect some lessons. First, of course, a leader needs the guts to stand alone and look ridiculous. But what he's doing is so simple, it's almost instructional. This is key. You must be easy to follow. Now here comes the first follower with a crucial role. He publicly shows everyone else how to follow. Notice how the leader embraces him as an equal. So it's not about the leader anymore, it's about them, plural. Notice how he's calling to his friends to join in. See, it takes guts to be a first follower. You stand out and you brave ridicule yourself. Being a first follower is an underappreciated form of leadership. The first follower transforms a lone nut into a leader. If the leader is the flint, the first follower is the spark that really makes the fire. Now here's the second follower. This is a turning point. It's proof the first has done well. Now it's not a lone nut and it's not two nuts. 3 is a crowd and a crowd is news. A movement must be public. Make sure outsiders see more than just the leader. Everyone needs to see the followers because new followers emulate followers, not the leader. Now here come 2 more people, then 3 more immediately. Now we've got momentum. This is the tipping point, and now we have a movement. As more people jump in, it's no longer risky. If they were on the fence before, there's no reason not to join in now. They won't stand out, they won't be ridiculed, and they will be part of the in crowd if they hurry. And over the next minute you'll see the rest who prefer to stay part of the crowd, because eventually they'd be ridiculed for not joining. And ladies and gentlemen, that is how a movement is made. So let's recap what we've learned. If you are a version of the shirtless dancing guy, all alone, remember the importance of nurturing your first few followers as equals, making everything clearly about the movement, not you. Be public, be easy to follow. But the biggest lesson here, did you catch it? Leadership is overglorified. Yes, it started with the shirtless guy, and he'll get all the credit, but you saw what really happened. It was the first follower that transformed a lone nut into a leader. There's no movement without the first follower. See, we're told that we all need to be leaders, but that would be really ineffective. The best way to make a movement, if you really care, is to courageously follow and show others how to follow. When you find a lone nut doing something great, have the guts to be the first person to stand up and join in.
I was a little reluctant to use that video because I know, of course, you're not going to remember a word I said, but you're going to remember there was a video of a shirtless dancing guy. But I just think that video makes a really important point. You know, there's tons of books about leadership, and there's a great book by an author named Gary Wills called Certain Trumpets. And he says, we do not lack leaders. Various trumpets are always being sounded. Take your pick. We lack sufficient followers. There is always the problem with leadership. Calls are always going down into the vasty deep, but what spirits will respond? Fundamental insight, really, Gary Wills, and the fundamental insight of this video is that leaders need to understand followers better than followers understand leaders, but more importantly, we're all followers. That even leaders must be followers much of the time, and it is a crucial role. And that the formula, and as Shirtless Dancing Guy instructs us, the formula is about leaders, it's about followers, but actually it's about the goal. It's actually about the purpose, the goal, the aspiration. That's the equalizer between leader and follower. Because followers do not submit to the person of a leader. They join up. They sign up. They sign up for the goal. And motives may be different, interests may be different, but there has to be that sense of shared enterprise. There has to be that commitment to enlisting as part of the movement. And so that is my challenge to you for today and for this conference. I would reframe that question. The question that you see is, what kind of leader are you? I'll reframe it into the language of the video, which is, are you going to be a lone nut, or are you going to be the first follower? If you're the lone nut, what is your shirtless dance? And if you're the first follower, what movement do you want to help create? And I hope I've been able to convince you that investing in the well-being of children and families is a movement that will, in fact, change the whole community. And that whether you decide to empower a lone nut by becoming the first follower, or to be out there on your own to help mobilize people to join you, both of those are incredibly important functions. Thank you. Have a great conference. I appreciate the work you do every day in our communities.
So we have a few minutes for questions. Perfect.
Hi, my name is Brian Marks. I work at the Cochrane District Social Services Administration Board. I frankly don't really know where to begin because I've spent the last little while on a bit of a crusade when it comes to supportive housing. And I think back to my privileged career, having been able to touch a number of different services that we already deliver, whether it's childcare, Ontario Works, and housing. And I think for the most part, people in the room know that it's not any one particular set of resources that we can apply, whether it's housing first or childcare first. It's all of them together that benefit the child, the family, the parents. And the crusade I've been on lately is with healthcare. So it's kind of confusing to hear your first comments focus around what the socioeconomic impacts are related to healthcare. Because in the healthcare tables that I sit at, it doesn't exist, the acknowledgement of social economic impacts on the healthcare of children or older adults or seniors. So I think to some of the decisions that got made 15, 20 years ago in education about preparing our children for the competition in the global market and the impact that had on physical education and how that has led to or contributed to childhood obesity, and thinking down the road how that leads to the onset of dementia, because if these kids are even lucky enough to make it to that age, they won't benefit from the single largest mitigating factor against dementia, which is physical activity. So I just want to say that I welcome your comments, and I'll be your first follower, which unfortunately for you makes you the dancing fool with no shirt.
I've been called a lot worse over time.
So the question I have is, on a daily basis, if you could share some of your frustrations or some of your successes on how you've held non-traditional partners accountable to serve the greater peace. Coming from healthcare, how have you held maybe people in our field accountable, and how would you suggest that people in our field hold people in healthcare accountable to achieve the greater end?
So, you know, I was chatting with Aaron as we came into the conference, and one of my observations about a month in to my role at CHEO was how fundamentally similar the culture of CHEO was to the Youth Services Bureau, where I had spent 4 years as the executive director. And the Youth Services Bureau is a social service agency in the child and youth mental health world, but it's part of the social service delivery system, housing shelters, youth custody detention, clinical programs, employment programs. And usually, when I tell people that, they're surprised. And one of the things that I've learned in the health and social services world is we are very committed to our own silos. And we're very committed to the uniqueness and superiority of our own silos. And so I think one of the things that we can do is to start to break those down. And one of the things that's always struck me is, so when I'm in conversation, and Aaron didn't, to his credit, have this reaction, but typically when I say that an academic health science center and a social service agency have the same culture, people don't believe me because of their preconceptions of what each of those things, which each of those entities are. So this is my very long-winded way to get to answer your question. I'm not going down a rabbit hole here. The point being, whatever we can do to close the gap between our silos as service providers, I think is positive. So in this community, what CHEO has tried to do over time, and certainly well predates me, is through vehicles like the Child and Youth Health Network of Eastern Ontario, try to connect with the broadest understanding of what health means. And I think the opportunity here, there is an opportunity, because I think folks in the healthcare system are understanding that we're not going to expense manage our way out of the demands we're facing. And that we do, in fact, need to deal better with some of those root cause issues. And so I'll give you an example. On the adult side, in the general hospitals, here in Ottawa, the Ottawa Hospital has done an analysis of some of the of their frequent flyers, the folks who are in their emergency department most frequently, who are using the resources of the emergency department, and who are admitted most often into the hospital. And surprise, surprise, the biggest single group of those are folks who are chronically suffering from mental illness. And the intervention that will keep them out of the hospital is supportive housing. And so now in our community, the Chief of Staff of the Ottawa Hospital, many of the leading voices of the Ottawa Hospital are in fact champions of making investments in and committing support to supportive housing programs. And I think the more we can work across our silos, the more we're able to support each other. And I would like to see folks from social service agencies standing up and making the case for why we need investments in hospitals. And I'd like to see folks from hospitals getting up and making the investment of making the argument why we need investment in childcare and supportive housing and other social services.
So Patty Moore, Haldeman, Norfolk, congratulations to OMSSA for starting a social services conference with a health speaker. This is a dream for 6 or 7 years that I think we've had, and certainly the board's taken that dream of the whole concept of human service integration, and breaking down the silos is the only way we'll change our culture and our country and for the future of our children and us as seniors, and I'll speak that because I'm getting there really quick. I think I hear what you, the first question was about health care. But as I've done this over the last couple of years, I encourage you to connect with your public health units, because they aren't about health care, they're about prevention. And that's where we really need to move. That's where the resources and the breaking down the silos need to be, because the work that we do is all about having those supports to prevent people from getting to CHEO. And I know the hospitals do a lot more around prevention, but the health units' mandates are all around prevention. So if you're not partnering with them, and if you're not talking to them, and you're not looking ways to work together, that's where the next step we need to move in the human service integration journey, I truly believe. I know a lot of CMSMs and DSEBs are working on integrating housing and income support and child care and child services. Public health needs to be the next partner. So it wasn't really a question. Just
No,
a
and nothing to disagree with. Absolutely, and certainly, as you would imagine, at CHEO we work very closely with the many public health units in our region, because you're right, there's certainly a values alignment, and there's a commitment to the same kind of objectives.
Thanks. I really wish we had more time, but we do have to continue with the day. We've got a heavy packed agenda of things for you to do. I really want to thank Alex. It's great to see him. I wish I spent more time with him other than coming to events these days. But if you could join me in thanking him for the excellent presentation.